Dr. Julia Turner, and I'm going to tell you how you can try to tell if you have coronavirus or not. So what symptoms should you be looking out for? The most common symptoms are fever and cough, although you don't have to have both. Some people only have a cough and no fever, or fever and no cough. The third main symptom is shortness of breath, but this only occurs in less than a third of patients. Other symptoms which may be present are body aches and tiredness, loss of appetite, sputum production, so this means a productive cough as opposed to just a dry cough, and occasionally people may have headache, sore throat, or diarrhea, although these are not as common. Some people with coronavirus can get some strange symptoms like losing their sense of smell and losing their sense of taste. I quickly want to explain what a fever is, because in South Africa many people refer to a fever as being a flu, so symptoms of sneezing, coughing, etc. In this case, we are actually talking about a fever being a temperature, meaning that your body is hot. You might feel hot and then cold and then hot again. This is what we are referring to as a fever. The most dangerous symptom to look out for is shortness of breath. If you're having any difficulty breathing, feeling like you have to breathe very hard or very fast, then please go to hospital immediately. It's not possible to tell just by symptoms whether you definitely have coronavirus or not, so you have to actually test for it. And the test that we are doing at the moment is a nasopharyngeal swab combined with an oropharyngeal swab. That basically means the doctor will have to put a little swab, which is like an earbud, into your nose and into your mouth, and then we send it off to the lab. Other tests that can be done are sputum samples and blood tests. In South Africa, we have strict criteria to determine who should be tested for coronavirus. The NICD is currently changing these criteria as the pandemic changes. So please check what the latest version is at your time. At the time of me doing this video, our criteria is that you have to have one of these 4 symptoms, either a cough, fever, difficulty breathing, or a sore throat. And the criteria to define a high-risk patient is someone with any of those symptoms, but as well having a known positive or suspected contact, having traveled to or living in a place with local transmissions, or a healthcare worker or someone working in a facility with positive cases. So who is a contact? Is it anyone you pass in the corridor? No. So NICD have strict definitions of what a contact is. In general, you have to have spent at least 15 minutes within 1 meter of an infected person to be called a contact. So it can be people who live together or work closely together, who travel together, or a healthcare worker or someone else who's cared for a patient who tested positive and they were not wearing protective gear. If a healthcare worker was wearing the necessary protection, then they are not considered a contact and they don't have to be quarantined. This is one of the very important reasons why it's so necessary that healthcare workers wear the necessary protection. Besides for their own safety, it also means that they can continue working. If all our healthcare workers have to be quarantined for 2 weeks after seeing a positive patient, then we'll have no healthcare workers left to work. Thank you for watching this video. Please look out for others like this. The numbers that you can call.